questions. Let's see what are they. First is, what are the vital signs? See, the vital signs are the most crucial medical signs that indicates the status of the body's vital function. What are they? They are temperature, pulse, respiration, BP, oxygen saturation. And the normal temperature should be 98.6 Fahrenheit and the pulse should around 60 to 100 beats per minute, and the respiration should be 12 to 20 breaths per minute, and the BP should be 120 to 80 mm of mercury. Oxygen saturation should be 95 to 100%. Okay. Next, is what are the common sites to check the body temperature? These are oral, axilla, rectal, temporal. You can see here oral, axilla, rectal and temporal. Okay. Then next is, what are the common sites to check the pulses? These are temporal artery, carotid artery, brachial artery, apical artery, radial artery, femoral artery, popliteal artery. This is the dorsal pedis artery and posterior tibial artery. Okay. Next we have, what is the fifth vital sign? See, the fifth vital sign is our pain. How we can measure? We can measure it with the help of numerical rating scale. Here you can see 0 to 10. Okay. So 0 indicates no pain. Here you can see this face. Okay. Then is your 1 to 3. 1 to 3 indicates a mild pain. Here there is a difference in the face. No? Then is the 4 to 6 is the moderate pain, and the 6 is for the severe pain, and 7 to 9 is for the very severe pain, and the last, the 10 is for the worst pain possible. Okay. Next is, what are the stages of pressure ulcer? See, there are different stages: stage 1, stage 2, stage 3, stage 4 and stage 5. So first stage, it involves the superficial layer of the skin. Only redness will be there. You can see here, this is the stage 1. Next is stage 2. It involves the epidermis as well as the dermis. So the first layer of the skin is lost in this stage 2. Then comes the stage 3. It involves epidermis, dermis as well as the subcutaneous tissue. Here you can see. Then in the stage 4, it involves the bones. Okay. Then osteomyelitis will be there. Osteomyelitis means the inflammation of the bone. Then stage 5 is unstageable. Okay. So the black color scar will be there all over the ulcer. Okay. Next we have, what is the best and the cheapest method for prevention of infection? It is hand washing. With hand washing, we can break the chain of infection also. So what are the types of hand washing and what is the time limit for each? We have social hand washing, medical hand washing and surgical hand washing. Social hand washing, we generally wash our hands before eating food and after eating foods. So simple hand washing is we called as social hand washing. Then we have medical hand washing. We use soaps to wash our hands, and generally the time limit for this is 30 to 60 seconds. Then we have surgical hand washing. Surgical hand washing we did before the surgery. Before doing any aseptic technique, we have to wash our hands surgically, and the time limit for this is 3 to 4 minutes. We have to rub our hands, scrub our hands. With this we make the friction. With the friction we helps to wash off the pathogen, our maximum pathogens out of our hands. So that is why we have to do this hand washing for 3 to 4 minutes. Okay. Then next is, what are the steps and the movements of hand washing? hand hygiene. Generally we have 7 steps of hand washing. You can see here, palm over palm, right palm over left dorsum, and vice versa. Then interlacing, interlocking, rotational movement of your thumb. So with this we have to wash the base of the thumb. Then the tips of the fingers, rotational movement of your fingertips we called. Then up to the wrist. Up to the wrist we have to rub both the wrists in a rotating manner. With this, these are the 7 steps of hand washing. Okay. Then we have, what are the 5 moments of hand hygiene when we have to wash our hands. See, before touching the patient, before doing any procedure, before a clean aseptic procedure, we have to wash our hands. Okay. Then after doing any procedure, that means after body fluid exposure risk, we have to wash our hands. Then we have, after touching the patient, we have to wash our hands. Last is, after touching the patient surrounding, we have to wash our hands. Okay. Next, what are the different ways of oxygen administration? So we have non-invasive as well as invasive method. So in non-invasive we have nasal cannula. You can see here, this is nasal cannula. With this we can deliver 0 to 6 liter of oxygen per minute to the patient. Next we have face mask. With this we can deliver 6 to 10 liter of oxygen per minute to the patient. Then we have high venturi mask. Here you can see this is the mask, and this red device which is attached to this mask. This is usually we called it as a venturi device or a venturi mask walls. So this comes in different colors. You can see here different colors like blue, white, this orange, yellow, red, green. So the venturi mask is also known as the air entrainment mask. Is a medical device to deliver a non-oxygen concentration to the patient on a controlled oxygen therapy. You can see here, this blue can deliver 24% of oxygen, this white one can deliver 28, orange can deliver 31, and this yellow 35, red can deliver 40% of oxygen, and this green valves can deliver 60% of oxygen. Okay. So with this high venturi mask we can deliver 12 to 15 liter of oxygen per minute to the patient. Okay. Then we have mechanical ventilation. In mechanical ventilation we have CPAP, that is continuous positive airway pressure, and BiPAP. BiPAP is also known as bilevel positive airway pressure. When the patient, just to assist the patients to for the this device we can assist the patient for breathing. Okay. Then we have invasive method. Under invasive method we have endotracheal tube and tracheostomy tube. Endotracheal, the word endo means inside, tracheal means inside the trachea. We have to insert the tube. So here you can see this is the endotracheal tube. With this we can deliver the oxygen to the patient, and this is the invasive method. And next we have tracheostomy tube. Here you can see this is the tracheostomy tube. See, tracheostomy, trachea, ostomy means the opening. Here we have to make a surgical opening inside the trachea and insert the tube directly into the trachea to deliver oxygen. So this is known as tracheostomy tube. Okay. Next, what are the 10 rights of medication? These are right patient, we have to give medication to the right patient, right drug we have to give at a right time, and then in the right frequency we have to give, right dose we have to give, right route, right assessment, right evaluation, right documentation, right education, and the last is right to refuse. This is the right of the patient to refuse. Okay, so these are the rights of medications. Then next, name some emergency drugs. These are injection adrenaline, injection atropine, injection noradrenaline, injection amiodarone, injection dopamine, injection dobutamine, injection furosemide, injection calcium gluconate, injection soda bicarbonate, injection magnesium sulfate, injection aminophylline, injection hydrocortisone, injection midazolam, injection lidocaine, injection diclofenac, injection tramadol, injection paracetamol, injection insulin, and the last is dextrose. Okay, so these are some emergency drugs. Next we have what are the antidotes. So we have specific drug substances, drugs and their particular antidotes. Let's see what are they. First, acetaminophen. Its antidote is acetylcysteine. Then anticholinergics, its antidotes are physostigmine. Then benzodiazepines, flumazenil. Then heparin, protamine sulfate, iron, deferoxamine. Then insulin, glucagon, opioids, naloxone, and the last is warfarin. Its antidote is vitamin K. Then what is the normal HB level in the adult? HB is hemoglobin level in the adult. It should be 14 to 16 gram per deciliter for the males, and in females it should be 12 to 16 grams per deciliter. Okay. Then next we will do what are the preferred and the non-preferred site for IV cannulation. So for the preferred sites, first is the veins of the dorsum of the hand is the most preferred site, and second the veins of the forearm. These are your cephalic vein and basilic veins. And next is the median cubital vein. Median cubital vein of your antecubital fossa is the most commonly used IV cannulation site. Okay, median cubital vein. And next is your non-preferred site. These are the near to joint, branch site, thin veins, varicose veins, inflamed veins, etc. Okay. Then what are the normal value for the following electrolytes? Electrolytes like sodium, potassium, chloride, calcium, phosphate, magnesium. So normal value for the sodium is 135 to 145 millicurie per liter. For potassium, it should be 3.5 to 4.5 millicurie per liter. For chloride, it should be 96 to 106 millicurie per liter. For calcium, it should be 9 to 11 mg per deciliter. 2.8 to 4.5 mg per deciliter for phosphate, and the normal value for the magnesium is 1.3 to 2.1 millicurie per liter. Okay. Next we have what is PPE and give examples. See, PPE is a personal protective equipment, commonly referred to as a PPE. What is it? Is an equipment want to minimize the exposure of hazards that cause serious workplace injuries and illnesses. What are they? Let's discuss. First is mask, second gloves, head cap, goggles, gown, shoe cover. Okay. Next, what is code blue? See, the code blue is a term used to alert the code blue team. What is the code blue team? Code blue team is the resuscitation team to an area where it should be in the hospital, in the institution in which the patient is in a cardiopulmonary arrest. Okay. Then what is BLS and ACLS? See, BLS is the basic life support, ACLS is the advanced cardiac life support. And what is the chest compression and respiration ratio? It should be 30:2. That means 30 compression and 2 rescue breaths. Okay. Next we have what are the 2 shockable rhythms? See, 2 shockable rhythms are, first is ventricular fibrillation, second is pulseless ventricular tachycardia. Okay, So these are the two shockable rhythms when you have to give the shock to the patient. So this is all about today's video. Thank you for watching. Hope this video is helpful to you all. Thank you.